Hello, my name is Olivia Matzis, and this is my video for my pocket guide for NU664. I made my pocket guide in a binder, and I put all the pages in sheet protectors and put all these little tabs. I have about 21 entries in my pocket guide, all from topics that we learned this semester. So the first one is a table for medications used for sinusitis, the advantages and side effects. And then next we have, I put a algorithm from Up to Date on the treatment of acute bacterial rhinosinusitis. Then I made another table of medications for asthma and COPD, and what ages they can be used for, teaching, and side effects. And then the next one I have is another table for medications for smoking cessation. And then there is another algorithm for treating pneumonia and what antibiotics to use. Next, I moved on to cardiac medication. So I made this big table. It's a couple pages long of all the cardiac medications for blood pressure, heart failure, and the statins and other cholesterol medications. So yeah, it's a couple pages. And then that includes like what it includes their use, the medications themselves, who you can use them for, and side effects. The next section I did I just a couple EKG rhythms just to have the basis of that. And then the next one is this picture. It is the algorithm for starting statins and what statin you need to start if it's a high intensity versus moderate intensity. And this is a table just about statins, the dosing of statins. That's a couple pages long. And then the next section is another table. It's of the oral diabetic medications. So the side effects of them and if they're safe in pregnancy or not, side effects, everything like that. And then I have these two pictures. This is just more about the oral diabetic meds, and then this is the algorithm to start the oral diabetic meds. Then the next page I have is the algorithm for starting insulin or adding insulin. This table is just a table from Up to Date about monitoring what you monitor for people with diabetes. This is a risk factor table for statins and ACE inhibitors, beta blockers. Then the next section I have is on thyroid. So I made a table of the signs and symptoms of hyperthyroidism versus hypothyroidism, and the TSH levels in T3, T4. And then the other part of this section is the treatment of hyperthyroidism and hypothyroidism. In the next section, I put this picture of the abdominal quadrants just to have a reminder of where things are in the abdomen. And then I have a section on adult GI issues. So I have acute appendicitis, how you diagnose it, treatment. Then the next one is cholelithiasis and cholecystitis, diverticulitis, pancreatitis, and then ulcerative colitis and Crohn's. And then I also have IBS and and constipation and diarrhea, as well as peptic ulcers and GERD. And then the next section is pediatric GI issues. So a lot of them are very similar to adults. So I just did constipation and diarrhea and how to treat those in kids. Moving along, the next section is pediatric heart conditions. So I included Kawasaki disease, the signs and symptoms of it, what ages it occurs, how you treat it. And then I also included acute rheumatic heart disease, and again, how to diagnose, how to treat. Then the next section is on pediatric labs, so what labs should be normal, what every lab means for pediatrics, the labs for anemia in kids, urinalysis, how to understand that. Then the next section is on methods of birth control. I made another table. It includes how they work, the mechanism of action, the failure rate, advantages, disadvantages, who can use each method and who can't. That's a couple pages. And this is just another table about all of the types of birth control. And then my last section is STD screening recommendations for men and women, women who are under 25, over 25, if they're pregnant and if they have HIV, and then men if they have sex with women, with men, and if they're infected with HIV or not. And then the rest of it's there, and then that's my references, and that's it. That's my pocket guide.